Everybody, well, April is Oral Cancer Awareness Month. Medical professionals sounding off about the warnings of smokeless tobacco.
Here to talk about the dangers of dipping is Dr. Paul Kim from Great Expressions Dental Center. Dr. Kim, thank you so much for joining us.
Hi, thanks for having me.
How common is it for people to chew tobacco? You don't really think of it happening much because they can hide it very well, but do a lot of people dip, as they call it?
Oh, absolutely. There's this prevalence of chewing tobacco, dipping tobacco in baseball, as you know.
Sports, and young people look up to these, and so that's a big danger, isn't it, Doctor?
Absolutely. We want to just reach out to the young folks out there and tell them to make wise choices in staying away from chewing tobacco.
What are some of the signs that someone who has been a tobacco user could have some oral cancer? What do you look for?
The sort of signs you want to look for is elevations in the oral cavity, maybe red spots, white lesions, even ulcers that might mimic a herpes sore.
Okay.
So this chewing tobacco, because you know, a lot of people, you look at it and sometimes it's just cut up leaves. What is it that it does to your mouth that can cause these cancers?
Well, chewing tobacco or dipping tobacco has about 28 cancer-causing elements in it. This is something you want to stay away from. You know, make wise choices and why introduce unhealthy product into your body?
Is the risk of oral cancer greater than smoking cigarettes with lung cancer? What's the ratio there? Is it a higher prevalence of cancers with dippers?
Well, the incidence of lung cancer actually decreases with chewing tobacco, but the increase in oral cancer will definitely be there.
And esophageal cancer as well?
Oropharyngeal cancer, correct. So there's about 50,000 people that are diagnosed with oral cancer annually. That's one person dies every hour of oral cancer. So that's pretty frightening. That comes out to about 8,700 people annually.
Yeah.
And is chewing tobacco typically the root cause of this oral cancer? What else can cause oral cancer?
There's a higher incidence of sexually transmission of HPV 16. That will occur in typically younger folks. So you will see a higher incidence in younger people because historically it was a 40 and over male type of disease. But now it's you see a higher incidence in younger people.
Yeah. And do you see the addictive qualities of this? Is this something that, obviously, it's not easy to kick, so what do you recommend for folks?
Gum.
Gum? Nicotine gum?
No, just plain gum, no nicotine in it.
What does the nicotine do to the mouth? Is that one of the toxins that can cause the cancer?
Definitely. Nicotine, as well as, again, 28 other toxins. So you just want to stay away from this. This is just bad stuff.
So you're saying that tobacco companies don't put anything good in it? I joke with you, it's a vegetable, it grows in the ground. There's absolutely no redeeming qualities. Can we clear that up, Dr. Kim?
Yeah, hopefully the tobacco industry stock will go down after this.
Well, I know in baseball we talked about how major leaguers still are allowed to do it. Minor leaguers are not because of their access to kids and stuff, but that's a message that baseball doesn't really want to send out, does it?
Oh, no, definitely not. I just want to get the awareness out there that chewing tobacco, smoking tobacco, just stay away from this product. There's other elements that also contribute to oral cancer. Alcohol consumption, lifestyle. Just make sure that you see oral health care provider. You see it all. Thank you, Dr. Kim. Appreciate that. Great advice for us. Absolutely. Appreciate it. Yeah, so just make sure that everybody goes to their oral health care provider, gets checked out. At Great Expressions, we do visual examinations on everybody. That's very good.
Perfect. Thank you very much, Dr. Kim.